All right, good morning, Mr. Smith. My name is Sandra. I am your student nurse, and I am going to suction you. Patient's okay with me suctioning. I'm going to do my assessment. I'm going to assess lung sounds. I'm going to assess the respiratory rate, pulse ox, the oral cavity. I'm going to assess the nares, and let me check my two identifiers. All right, so the patient is ready for me. I'm going to have my my drape here at the top. Thank you. So I'm going to put my drape over the patient's chest. Right. All right. He is ready. I can also turn on my suction device. Jonathan. All right. So yeah. So I'm going to turn it on between 80 and 120. I'm going to have my settings already prepared. All right, and I am going to get started with the suctioning. So we know that nasopharyngeal suctioning is a sterile procedure. I have my kit here, so I'm going to open my kit. I'm going to put on my sterile gloves. And also remember that for suctioning, the patient needs to be in semi-Fowler's or Fowler's position. If the patient was unconscious, they would be in a lateral position facing me. All right, so I'm going to put on my gloves. This is backwards, but you know, have to work. All right, so remember that your non-dominant hand is going to be your non-sterile hand. Your dominant is your sterile hand. So I'm going to set up my container. Here. Let me. Thank you. Thank you so much. All right. And so my sterile hand, I'm going to remove, thank you, my catheter. All right. So I'm going to gather here, and I'm going to connect like this. My non-dominant hand. Right. So this is my sterile. Yes. So this is the chimney. I'm gonna check to see if the suction is working. Right. So my catheter is working. All right. So I'm gonna lubricate the tip of the catheter. The patient is aware that I'm going to use the right area, so I'm going to be on the right side. All right. So I'm going to insert the catheter. But first, let me do my pre-measure. All right. So we have the tip of the nose to the ear. So that's somewhere here. All right. All right. In. Do I lubricate? It's hard to go in. Never mind. This is plastic. So as we go in, remember we don't suction going in. So in to our pre-measured point, and then we suction coming out. So you turn the catheter as you come out. Out. All right, and we're going to clear the area here. We clear the line. All right, we can go in a total of 3 passes, no more than 3. All right, we go in one more time. We lubricate the tip. We go in to our pre-measured distance. All right, and then we come out. We turn the catheter, coming out. We clear the line. All right. So let's say the patient was okay with that. Okay. After we're done with the suctioning, we're going to document how the patient tolerated, the type of exudate that came out of the catheter, if the patient was in any pain, the type of catheter we used, the lung assessment, the NARI assessment. Okay, so I am going to now suction the oral cavity. So mostly you can cleanse this catheter here and go into the oral cavity. Okay, go into the oral cavity. So we go in from the mouth, right, to the lateral side of the mouth, to the side of the mouth, and we go down 3 to 4 inches, right? So you know you're going to hit the gag reflex. The patient will gag. So it's always good to make sure that you assess the gag reflex. So again, you suction as you come out.
So same concept as far as the length?
Same, yes, same concept. So you clear the tubing, right? Pre-oxygenate if necessary. In between each pass, you may want to pre-oxygenate the patient into the oral cavity.
So we're still working with the nose, from the ear to the nose?
This is the nasopharynx, yes, same length. And that one's actually 3 to 4. All right, so we go in and we're suctioning coming out. All right, so as we clear that out, we clear the line. Now then 2, right? So let's disconnect this one. And the way you toss this out is you pull off one glove and you wrap this inside of the glove. All right, let's say the patient had very thick, tenacious mucus. You use the Yankauer. And you always encourage the patient to cough. Cough. Even when you're suctioning them nasopharynx, or nasopharyngeal, you encourage them to cough during the process because it helps to bring up the mucus. So the Yankauer is just for the oral cavity. You don't go beyond the oral cavity. It's just to cleanse, out thick, tenacious mucus. Same thing. Now, with using a Yankauer, you have to be very careful. If the patient is combative, they can bite this. If they're disoriented, they can bite this and crack their teeth. So we want to make sure we're careful when using the Yankauer. Okay, that's it. Thank you.